Doctors miss all kinds of useful information on lab work. In this video, I'd like to highlight my functional health analysis of laboratory blood work. It's my goal that by the end of this video, you'll understand the difference between the review of blood work solely to identify pathology and disease versus a functional health analysis of blood work to identify places where health has started to deteriorate. Evaluating lab work can be a daunting task. For many doctors, perhaps even your doctor, it simply involves running down the lab report, looking for the biomarkers with the results outside of the lab range, then coordinating the results with your history, other tests, and symptoms to diagnose a disease. This is the model of care in our current system. It is disease-oriented. That means if you have symptoms, etc., feel lousy, but labs are not outside of the lab range and you're taking your medication as prescribed, they've done their job and managed your disease. But what happens next? That doesn't alleviate your symptoms. For many people, it involves years of getting used to living with the symptoms or finding other doctors who tell you more of the same. I'm going to highlight the difference in how I look at lab work to identify places where you've lost your health, even though you're still healthy by your current doctor's standards. First, it's important to know a little bit more about how laboratories create their lab ranges. If you're listening closely, you heard me correctly. I'm going to tell you more about how labs create their lab ranges. This may surprise some of you, but a substantial portion of lab ranges are based on averages of the people who get their labs drawn from a particular lab company. Let's take thyroid stimulating hormone, or TSH, for instance. It's like this. All of the people who get sent to a lab for TSH testing are plotted on a bell curve. As an approximation, the lab may take the 5% with the lowest scores and the 5% with the highest scores and list those ranges as the limits of the lab range, leaving the other 90% of the people tested with a normal result. The problem with such a broad range of labs is that you may have symptoms when your body's response may not measure outside of the lab range, or you may have all the symptoms of a problem, for instance a thyroid problem or autoimmune issue, and your labs may still be normal. Therefore, you don't have a disease, and you don't have a place in the current system. My functional health analysis is different. We use a tighter window of lab ranges to identify those on top of the bell curve who are healthy, and distinguish them from those who are sliding off its edge toward the bottom where disease lies. This allows for recognition of areas where you may have lost your health and developed symptoms, but they're not clear-cut enough for the conventional system to identify a disease. In short, this allows me to help people rebuild their health, almost irregardless of whether or not they have a diagnosed disease. When we look at lab work with a focus on finding health versus disease, it changes the entire picture. It also provides hope for those who have been lost in the cracks of a disease-focused healthcare system for far too long. For more details about expanded lab work and my functional health analysis, please watch my comprehensive metabolic testing video, and I'll go over a case example from my practice so that you can see the enormous amount of information that your doctors are likely missing when reviewing your lab work. Simply click this link, or if it's not appearing, keep watching for more information on how to see this video or contact my office for help. I'm Dr. Richard L. Robles, and I look forward to helping you find your path to health.